My first question for Dr. Summers. Many people are hurting as a result of the ongoing and escalating drug crisis, but there are some who benefit from it. Those who produce and sell the products driving this opioid crisis are making money off the suffering of others. And whether they wear hoodies in dark alleys or suits and ties in the halls of power, these drug dealers are benefiting from the pain of the most vulnerable. You've talked about public health officials like Dr. Perry Kendall, who have gone from health policy roles where they advocate for decriminalization and so-called safe supply directly into business selling pharmaceutical-grade hard drugs. Do you think there should be rules in place to prevent former public health officials from going on to financially benefit from their previous positions?
Thank you for the question. Yes, there absolutely should be rules. These types of relationships should be transparent. The Stanford Lancet Commission urged the same thing. In fact, when they assessed the roots of the North American opioid crisis, Canada and the US, the first area they highlighted were conflicts of interest and the movement. And Dr. Kendall unfortunately illustrates this, of people who move from roles in senior public health and governance roles into, in his case, the BCCSU, and then also into roles with other organizations like the BC Centre for Disease Control, which has been flagged as a source of funding for the very company that he and Dr. Schechter started. So it's one thing to consider whether the action of moving into pharmaceutical provision of drugs is a sensible thing. It's quite another to be advocating for that and setting oneself up to be the provider. So yes, there should be transparency.